Hello, my name is Dr. Ryan Senheinrich, and today I would like to talk to you about mercury toxicity. Now, mercury toxicity affects a good amount of people in this country, but largely goes undiagnosed. So the two main topics I want to talk to you today is number one, where do you get mercury from? And number two, why is it mostly misdiagnosed? So let's start off with the first question. You most commonly get mercury from amalgam fillings, from vaccinations, and from fish. The one that I want to spend the most time on is amalgam fillings. That's what I went through, and that's what most of my patients have gone through. So amalgam is the type of filling that you get put in, and it's silver, and it contains mercury. As that sits on your teeth, your body will slowly leach the mercury out of the amalgam into the bloodstream, and some of it will be stored away into fat tissue, nervous tissue, and even into the brain, while other parts of the amalgam and other parts of the mercury will be excreted. Then you get the other issue of what happens when the amalgam filling chips or falls out of your mouth, falls out of the tooth, and you swallow it. Your body will digest it, it will break it down, and once again, some of it will go into the tissue while other parts of it get excreted. And then lastly, you can have the amalgam fillings that get drilled, and it turns that mercury into a vapor. And now that vapor is breathed in, and it goes directly into the bloodstream at a very high level. So that's actually what I went through. And you can have a lot of symptoms when that happens. So let's move on to the second point. And that second point is, why is it not properly diagnosed? The reason is because it looks like a lot of other diseases. And just to give you an example, other diseases that mercury toxicity can look like are things like MS, ALS, bipolar disorder, depression, anxiety, chronic fatigue syndrome, and fibromyalgia. Now that is a lot of different symptomatology. That's why it's very difficult to get a grasp on, is it mercury toxicity or is it something else? Now I'm not saying that mercury toxicity is the cause or responsible for those other diseases. I'm just telling you what it looks like. Other symptoms that come with mercury toxicity are things like headaches, migraines, brain fog, fatigue, trouble sleeping, caffeine addiction, tinnitus or ringing in the ears, hearing difficulties, and other neurological symptoms. So once again, it covers a vast majority of symptomatology, also making it very difficult to diagnose based on symptoms alone. So this is where I like to stop, because most of the people that have had or currently do have mercury toxicity and don't really know it have been to multiple doctors, they've received multiple diagnoses, and they've received multiple treatment options, some that work, some that don't, and some that also come with side effects. So for those individuals that have been running around and haven't been able to figure it out, I want to tell you this. You are not crazy. It's not all in your head. There is an answer for what you're going through, and mercury toxicity might be that answer. Now I say this to individuals because when they come in, I'm typically the 5th, 6th, 7th doctor they've seen. They've gone through all this medication, all these different diagnoses, some which I've already stated before, and with a simple hair test, we've been able to determine that they have mercury toxicity, and we can start them on something called chelation therapy. So that moves me on to my next point. The next point is, if you suspect that you, your friend, a loved one, somebody might have mercury toxicity, how do you get that answered? How do you know for sure? Well, mercury is pretty difficult to determine if you have it or not because it likes to hide. So what we do here is we do a hair and mineral analysis. Now this is very important because this is going to allow us to look at multiple systems to see if your body is reacting as if it has mercury toxicity. We look to see if there's mercury in the hair, and that's pretty much a dead giveaway. But for the more complicated cases, people that have had it for long periods of time, you look for what are the minerals doing in the body. Mercury will affect mineral transportation. So either some minerals will be extremely high, other minerals will be extremely low. So we will look at that along with the hair sample and determine if you have mercury toxicity. And then once we've determined that yes, you do have mercury toxicity, we would move you on to what's known as chelation therapy. Now myself and my team included have all had mercury toxicity. So this protocol that we present to you is protocol that we've put together from things that have worked for us. We've done plenty of things that have not worked well for us, and we got those out of the way for you. So this protocol is not only going to have a chelator, but it's also going to come with other supplements to help make this transition that your body needs to go through much smoother. So if you have a friend, a family member, a coworker, somebody that is just having a lot of trouble and they don't know where to turn, or they're not sure what the heck it could possibly be, I would recommend getting the hair and mineral analysis done. It is inexpensive, it's quick, it's simple, you ship it off, and within a couple weeks we will have your answer for you. The best way is just to get in contact with us through our website and ask us any questions you may have. Thanks for watching.